Let me ask you a question. If AI can actually answer any health question instantly, why would anyone ever join your email list again? In fact, why would they even book an appointment? Because here's the thing, information isn't the same thing as belonging. Information isn't the same thing as strategy. And in the age of AI, you're no longer competing on answers. You're competing on the environment in which you deploy strategy and deliver care. My name is Dr. Meghan Walker. I am the chief cheerleader at Clinician Business Labs, the CEO and co founder of High Validity. And for the better part of the last 20 years, my work has sat at the intersection of clinical care, entrepreneurship, and ambition. Today, we're going to talk about the landscape that is changing and how you, as a clinician, can reach more people, have more impact in an era where AI reigns supreme, but where trust is routinely compromised and challenged and misunderstood. This is a really unique opportunity and moment for you. And how you reach more people gets to be the most authentic thing you have probably ever done from a marketing perspective. Today, I want to show you what the single most powerful low hanging fruit strategy is for any high trust practitioner. And it's not chasing leads. And it doesn't mean that you need to start building more and more webinars and high tech funnels. We're going to talk about the power of leveraging community. And I'm going to give you an exact 5-part framework in order to implement it in your practice and in your marketing over the course of the next week. So let's talk about why community has suddenly become premium again. It had a heyday during COVID, and then everyone was looking for more efficient in person pieces. And now we're starting to see a shift again. In an era where an AI version of you can be talking on all of your social media or delivering your evergreen webinar, people want to see you in a more raw form. And frankly, they want to see other people who look like them. So let's zoom out. We're kind of facing a perfect storm right now. AI is commoditizing information. Social media reach is unpredictable, and costs on every element of delivering a business and care is soaring. But the biggest factor is that we're in this full blown trust recession. The 2025 Edelman Trust Barometer. Yes, it's a fancy study looking at how people engage with brands and people in a position of authority. Found that the majority of people feel a deep sense of grievance towards institutions and that healthcare has actually been hit really hard. One study found that trust in physicians and hospitals has plummeted by over 71% in 2020 to just 40% in 2024. This is what we call a catastrophic collapse of trust. People used to trust us at a rate of 71%, and through a series of incidences, probably conversations related to COVID, probably poorly timed, rapidly deployed policies with respect to public health, and the advent of AI, we've gone from a 71% trust record to just over 40. And the trajectory is continuing to decline. At the exact time, people are also finding they are lonelier than ever. Mental health is rising across all sectors of our population. There's a deep fatigue with bots and automation and impersonality. And this creates a really powerful opportunity because when technology accelerates, human connection becomes more valuable, not less. Real humans are premium again. And for clinicians whose entire practice is built on trust, this becomes your unfair advantage. Not only do you have strong interpersonal skills, but you have a desire and inclination to actually connect with people. So let's talk about this as a strategic reframe. If community is hot again, what does this actually mean for your business? That you should be running retreats, that you should be running live events? Let's start to talk about the ways in which we could address community and, frankly, leverage community as a way to bring people into your practice. Most clinicians hear community and they kind of think it's a hobby. They start a Facebook group, they answer some questions, they hope that people book a call. That's not a strategy. That's wishful thinking. So we need to reframe this as a qualification mechanism. A well-designed community is going to do three things for your business. It's going to attract the right people who have a shared identity. You're going to do well to talk about what that identity is. We do really well in our community with people who want to get better, who want to engage in their health, who want to do the heavy lifting. Remember all the times you said, I want clients who want to do this? You can set those values right up front. It surfaces the most engaged members when you do this, showing them who is already ready for that next step. You can see who is consistently putting up their hand. It creates micro authority moments for you and leaders within your community every single day. And so it enables you to start to build trust at scale. You're going to have existing patients who want to be part of your communities, and you're going to have new people wanting to join at the same time. I remember back in the day when I was growing my practice, we had a really simple membership. But as part of our membership, we leveraged community, not just online, but also in person. We would give people the opportunity on our mailing list to vote on their favorite podcast episodes over the course of the last 6 months. And then I would invite those guests to come and join us for a really fun evening down in central Toronto where my practice exists. And I ran it at a beautiful club, and I served beautiful food, and I gave everyone tea or kombucha or a glass of Prosecco when they walked through the door. And one of the things that we said to people when they came to our event is that if they were a member of our practice, they could come for free. And one of the things we would also invite them and encourage them to do is to bring a friend. And that way the room was filled with people who already knew our philosophy, who already understood our values. And in inviting them to bring someone along with them, not only did we have an opportunity to start to expose the work that we do to more people, but it gave our existing membership and community the opportunity to not show up alone. And running these events 4 times a year became one of the biggest feeders of like-minded, high-quality clients right into our practice. See, being intentional around how we curate community, there isn't a one-size-fits-all approach. It's about the intention. It's about the leadership lens that you bring to the moment. I have a friend and thought leader, his name is Jason Gaynard, and he's noted that value is created in curated rooms where proximity matters. The goal isn't necessarily to make it big. It's to be specific and intentional. I've been to events where Jason has spent literally hundreds of hours curating the seating plan to make sure the right person is sitting beside somebody else. Curating the right community has the ability to change the trajectory of your business. But curating the values and curating the right room when it comes to health consumers, that also has the capacity to truly start to change their health. So if we're going to talk about community and whether you want to run it online or in person, whether you want to run dinner parties with a local organic chef or you want to run retreats, there are 5 pillars to engaging and creating a high value community. And I want to break those down for you as I sip on my smoothie and avoid coughing even more. So when we talk about community without a blueprint, it just becomes emotional labor. We've probably all been in that situation, right? Where we're the leader of our friends. We're the one organizing. We're the ones booking. We're the ones doing things. We're the ones driving the conversation. We want to make this interactive. The true power of a community is where everyone has a role, where everyone feels important. So there's 5 pillars that we want to look at when we're creating an intentional community inside our business. So it doesn't just feel like one more place where we're doing work. The first pillar is that we need to have a clear identity and outcome. So vague communities are going to fail. People join rooms where they feel seen. You must be ruthless in defining who this is for and what transformation is happening in the room. What can people expect when they come in and join you? Not support and discussion. Instead, stabilizing hormones without birth control or reversing insulin without resistance. Clarity is going to build gravity. The next is a structured cadence. It needs to be predictable. It can't be, oh, we kind of do our book club sort of whenever and bring whatever you need and I don't know who's going to be there. No, we need a little bit of structure. And that's where the leadership piece comes in. Communities die without rhythm. We know from every major study when it comes to forming relationships and friends that proximity and consistency matter. So if you want to build a community that's going to drive trust and people into your practice, you need to have consistency and structure. You need a predictable schedule. You need to know that it happens on the first Monday of every month. You need to publish it, and you need to make it easy for people to add it to their calendars and come. Low friction is what we are looking for in today's day and age. Pillar number 3, speaking of low friction, we need controlled and intentional entry. The best communities are curated, they're not wide open. So you need to be specific around how you bring people in, what they can expect, what the values and guidelines are of the room. Creating simple entry questions, like I'm sure we've all experienced inside a Facebook group or a school community, are going to set the container and the intention for the room. It's your job as the leader to do that. It's what makes and enables people to feel safe. Pillar number 4, we need conversion architecture. So it's all well and good if you want to do a ton of work and put people into the room and have them answer all the questions and you collect their email. But if you don't actually then deliver a mechanism for them to put up their hand and say, yeah, I want to work with you, or how do I learn more, or what does my next step look like, you're going to lose people. You also need to train your audience that this is something that you deliver inside your community. If you never position your services ever, the one time you do, or the one time you kind of need some new clients, they're going to feel that desperation. Lead with 80% value, but 20% a very clear on-ramp for how people can go deeper with respect to your work. This is exactly where strategy is going to meet action, and you need a system. So a welcome email sequence that sets those expectations, a link to be able to book a call and what people could expect on a strategy call with you, a way to track your most engaged members. The more systematized you can be at monitoring what's happening inside your community and what indicators suggest that someone has a heightened degree of interest, the better and easier it's going to be to continue to build out your practice from the initiative of that room. Pillar number 5, and our last component here, position yourself above AI. Don't be afraid of AI. Absolutely use it. Encourage your members to bring their AI-driven tools to the room. But let's also teach them how to leverage it. So let's acknowledge the elephant in the room. Let's use it to make the curation and running of our community easier. Let's use it to deploy and deliver low-hanging fruit, maybe in the form of a custom GPT or a series of prompts that they can use at home in conjunction with something you've been talking about this week. AI is on the table, and the more consistent we are in acknowledging its presence in the room, the more effective we are going to be at positioning and anchoring how we are unique alongside it. It's worth mentioning it when we are building community. If this room feels powerful, acknowledge the human element that made it so. The last part I want to leave you with is just the opportunity to stop and vision out how community could be part of your practice. Maybe you've always wanted to run retreats. Maybe you're envisioning how you could deliver an online community that enables you to reach more people. In a world of infinite information, the new scarcity is trust. Your authority is going to be strengthened. Your capacity to earn trust will happen with greater ease when you have a lens of intentionality around how you want to use it. You don't need to chase leads when you can simply observe behavior. The person who shows up in your live sessions and asks thorough questions is probably your next client. Ads are a tool that rent attention, but community is a tool that owns attention. In the next 5 years, the practitioners who win won't be the loudest online. They'll be the ones who build rooms people don't want to leave. Community is not a tactic, it is an infrastructure for the modern practice. A modern practice who very clearly wants to build their lead generation and their community on a foundation of trust. Now, for those of you who might want to go deeper on this, who want to learn and understand a strategy that you can use to create and leverage communities for new leads, or to monetize with strategy and communities in the form of retreats, we've got something really exciting for you coming up. Every year we run a live event. And if we're going to talk about community, it's only fair that I share an example of how we actually do this ourselves. We run a live event just north of Toronto, and it's called Clinic Camp. And we bring clinic owners and wellness entrepreneurs who are looking for more leverage inside their practice together. And this year, at the beginning of May, for the 4 days of Clinic Camp, we're going to be talking about community. How do we leverage community as a revenue stream inside our business? How do we leverage community in the age of AI to build trust? How do we build online intentional communities so that we are driving more people to our practice? What are the ingredients to run a supper club that enable us to reach high profile or highly interesting new clients? All elements of community and how we incorporate it into our practice are going to be broken down this year at Clinic Camp. It's happening the very first week of May. I promise you, you are not going to want to miss it. Whether we are cold plunging in the lake, or we are crafting in the corner while we are talking about strategy, or we're bringing in some really amazing guests who still at this point remain a secret, and we haven't announced all of them yet. We have an incredible 4 days together, and it literally feels just like camp. If you want more information about what those 4 days are gonna look like, I'm gonna encourage you to check out the link below. And if you found this video helpful, if you're curious about how community can help take your practice to the next level, make sure you hit subscribe because we have got way more on slate over the course of the next few weeks and months.